We have a lot of news to get through this morning, but we want to begin on the medical beat with the latest on President Biden's condition and the fight to contain both COVID and monkeypox. We're joined now by White House Coronavirus Response Coordinator, Dr. Ashish Jha. Welcome to Face the Nation.
Good morning, Margaret. Thanks for having me here.
Well, the White House physician has said that it's the BA.5 variant that likely infected the president. That's the dominant variant across the country right now. It's highly transmissible. How is the president's health, and do you know where he got it?
Yeah, so it is the BA.5 variant, which is, as you said, is about 80% of infections. The president's doing well. I checked in with his team late last night. He was feeling well. He had a good day yesterday. He's got a viral syndrome, an upper respiratory infection, and he's doing just fine.
There is so little known about long COVID, but given the president's age, do you expect that the White House will continue to make disclosures if he has long-term symptoms from this infection?
Yeah, absolutely. You know, we think it's really important for the American people to know how well their president's doing, which is why we have been so transparent, giving updates several times a day, having people hear from me directly, hear directly from his physician. And obviously, if he has persistent symptoms, obviously, if any of them interfere with his ability to carry out his duties, we will disclose that early and often with the American people.
About 6 out of 10 Americans, according to the CDC, live in areas of high transmission right now. That includes major cities like New York, Phoenix, Miami. There are no indoor mask mandates there. Does that concern you?
In areas of high transmission, I think it's very prudent for people to be wearing masks indoors, especially if they're in crowded, poorly ventilated spaces. That's what the CDC recommends.
I also want to ask you about this other health challenge with monkeypox. The World Health Organization yesterday declared it a public health emergency of international concern. That's the highest level of alert. The Biden administration, specifically HHS, has stopped short of doing that. Should you declare it a pandemic? Should you declare it a public health emergency?
We are seeing outbreaks that are out of control in many, many parts of the world, and it's very important that we get our arms around this thing.
But it is an emergency here.
Well, in the U.S. right now, we're looking at public health emergency as something that HHS might deliver, might invoke. But you know, it really depends on what does that allow us to do. Right now, we have over 2,000 cases, but we have ramped up vaccinations, ramped up treatments, ramped up testing. And we're going to continue to look at all sort of policy options.
You said back in May that you think we can get our arms around this. You said monkeypox is a virus that we understand. Are you saying today, just like then, you think monkeypox can be contained?
I do think monkeypox can be contained, absolutely. The way we contain monkeypox is we have a very simple, straightforward strategy on this, right? Which is make testing widely available. We have done that, and now testing is far more frequent and common.
It was slow.
Get vaccines out. Yeah, but we have right now the capacity to do 90,000 tests a week. 80,000 tests a week. That's an extraordinary number. We're going to be releasing hundreds of thousands of more vaccines in the next days and weeks. So there is a very substantial ramping up of response that is happening right now.
But I ask you about containment because you could have shifted allocation earlier, surged it differently, sooner switching from at-risk individuals to areas where there are active high case counts and an outbreak. The CDC director said just a few days ago her agency has no data on who has been vaccinated. She said there's one key important similarity with COVID and with monkeypox, and that is the CDC's inability to see data in real time. So this seems to be still an issue for our health agencies to act quickly to contain an outbreak. This is a problem.
Yeah, so what I'd remind us is that public health in America has always been led by states. It is important for states to be sharing data with CDC. We've been working with states across the country. Lots of states have been forthcoming, and my expectation is that in the days and weeks ahead, we're going to be able to get more and more data from states, and that will help us understand the national picture a bit more in a bit more detail. But we do have a pretty good feel right now for how Widespread monkeypox, as I said, about 2,000 or so cases across the country.
A fellow Democrat, Congressman Adam Schiff, who will be on this program today, sent a letter to HHS saying the federal government is falling short of the response that is needed. Skyrocketing cases, limited vaccination supply worldwide suggests that the monkeypox virus will continue to spread for years to come, if not indefinitely. Is monkeypox now endemic? Will it continue to spread indefinitely?
Well, it is endemic in certain parts of the world. It is not endemic
I'm asking
here in the
about
United
here.
States. And the plan here is very straightforward. The plan is to eliminate this virus from the United States. I think we can do that. We've got the vaccines and we've got the diagnostic tests.
There are now 2 children with it that the CDC knows of, at least. And the CDC said both of these children are traced back to individuals who come from the men who have sex with men community. How actively is this being spread? And are you still only talking about the gay community because you're only looking there?
Yeah, so we obviously know that this virus is spreading largely in the gay community among men who have sex with men. But obviously, there are other people who are at risk as well. People they interact with, anybody who has monkeypox can spread it to others. It is through skin-to-skin contact, direct and prolonged contact. We're doing a very broad surveillance. This is why not only have we ramped up testing capacity, we're encouraging physicians, working with physician groups to do more broad-scale testing.
I want to ask you about one other issue right now. We heard in the state of New York, the first case of polio in nearly a decade was confirmed in an unvaccinated 20-year-old man in Rockland County, New York. He was hospitalized back in June. Are there other cases? And if he was infected back in June, why are we only now hearing about it?
Yeah, so this is a place where the CDC is working very closely with the Department of Health. It is in an unvaccinated individual. Thankfully, most Americans are vaccinated against polio. Most of the world is vaccinated against polio. If you're not vaccinated against polio, critically important.
Right. Well, I have a small child. It takes time to get fully vaccinated. Should I be concerned that there are polio cases spreading in New York and in the United States?
You know, there's a lot of surveillance that we do for polio. There's wastewater surveillance that goes on. We are not seeing outbreaks of polio elsewhere. But I do not expect polio to become more widespread in the country, again, because so many Americans are vaccinated against this.
Dr. Jha, thank you for your time this morning. Face the Nation will be back in a moment. Stay with us.